Hi, I'm Jaya Regimatai. I practice in Texas as psychiatric nurse practitioner. Today I am going to talk about an interesting case. Can you imagine someone at your workplace smell alcohol, act like alcohol, and someone pulled over by the police? They did the testing and found the alcohol level is way higher, and they did not even use one drop of alcohol. And you are seeing a 3-year-old child has some fresh juice, fruit juice, and after that acting like an alcoholic. So, can this happen? Yes, this can happen. Yes, I have a scenario for you. One of my patients, she was around 45-year-old. When she came to me for the treatment for anxiety and depression. So, all her life, she was struggling with anxiety and depression, and she never seek any medical help for her anxiety and depression. She was using alcohol for her anxiety and depression. So, when she came to me, I gave her antidepressant medication. Her anxiety and depression got better, and her liver enzymes were way high. So, she was willing to stop using alcohol. She gone through the treatment, and for last 6 months, she was not using any alcohol. Then she come to me and said she went to the emergency room a couple of times because she was confused, disoriented most of the time after her dinner, and she said she can remember what happened, and in the emergency room they could not find anything. So again, when she come to me, she told me, yes, she is diagnosed with autoimmune Bowery syndrome. What happened? The emergency room doctors were not believing in the first what her husband was telling, because after her dinner, most of the night, she acted like a drunken, and even the husband was suspicious. He was thinking she became a closet drinker. She's hiding and using alcohol. So, and even the patient was not even recalling, not even able to remember anything. What is going on with her? So the husband did a video on her, how she was acting after her dinner, and showed the emergency room doctor, and they were able to diagnose her with autoimmune Bowery syndrome. Yes, autoimmune Bowery syndrome, gut fermentation syndrome, drunken disease. This is a very rare case. What happened? Can you imagine? After a sugar drink or some high starch food, your intestine brew some alcohol. Yes, how this happened? There are some people, they have excessive amount of yeast in their gut or intestine. This, with the help of starch, this yeast is converting the starch to alcohol. Who can get it? Anybody, any age, children to adult. It's very rare to born with it sometimes, but people with short bowel syndrome can born with it, especially for the kids. Then people has got Crohn's disease, people with some liver disease. Their liver enzymes were high. Even with a small amount of alcohol, they act like drunken excessively. Then we can see people with malnutrition, diabetic, people with some autoimmune disease, and some inflammatory bowel syndrome. This kind of, and people with low immune system also can have this. So, what are the signs and symptoms? Yes, you can see how people act under the influence of high amount of alcohol. like their face will be red and fresh, headache, nausea, vomiting, disoriented, confused, unsteady gait, and they are they are not even remembering what they are saying, what they are doing. And even some people, if you check the vital signs, their blood pressure will be way high up. So you can see a typical all the symptoms, how a people can act or do under the influence of high amount of alcohol. So how we can diagnose it? Unfortunately, there is no specific diagnosis for this rare condition. But one thing we can do some stool examination. The smear of stool is going to show the excessive amount of yeast. And there is one more test. We give some sugary capsule to the patient. We don't give anything else. Then we check their blood alcohol level. If they don't have ABS, autoimmune Brewery syndrome, their alcohol level will be 0. Otherwise, their alcohol level will be way high up. These are the only two kind of test is available now. What is the treatment? First of all, we have to treat the underlying cause. Then there are cases we treat with antifungal medication. While on antifungal medication, no sugar, no carbohydrate, no alcohol. And even the people who are prone to get this disease need to be follow strict diet. Yes, avoid simple carbohydrate food such as white rice, white bread, white pasta, and food contain high carbohydrate like chocolate, artificial sugar food, table sugar, fructose, dextrose, maltose. Those kind of food contain simple carbohydrate. Avoid it. Then what we can eat? Yes, the food contain complex carbohydrate and high fiber. For example, the food is made up of brown rice, the whole bread, then cooked and fresh vegetables, frozen and fresh fruits. So this ABS, this is a very rare condition. But after seeing my patient, I got an opportunity to read about it more, and we can see that recently for last couple of years there are couple of cases reported. The main cases reported are pulled over by the police. They got the charge for driving under the influence of alcohol. So even though this is a rare condition, but can put your life in a very critical situation, your life and someone else's life. So if any of you has any kind of, now I kind of remembering, my grandma used to tell me that after having a high starchy food, she used to say that she feel lightheaded. Now I doubt whether she was having it. So anybody has got any kind of symptoms like after high carbohydrate diet or high sugary food, please seek help. Don't put your life or anybody's life in a critical situation. Hope this video helped you guys. Thank you for watching. Please watch, comment, subscribe and like my videos. Thank you.